Thank you very much, and thank you for the invitation to Christchurch. It's the first time I've been to the South Island, so it's nice to come down here, and interesting, of course, and challenging to see what's been happening here 4 years ago, and how you're rebuilding the city. So, every November, I go to the World Health Summit in Berlin. It's hosted in the former Berlin, for the famous Berlin hospital, the Charité, in old buildings just close to the Brandenburg Gate. And when I walk to it, I go past a statue that commemorates a very famous German pathologist, Rudolf Virchow, who died about 112 years ago. His main claim to fame, of course, is as a pathologist, giving his name to the triad of factors that leads to thromboembolism, and which most of us are familiar with. But it's his political perspective that has most inspired me. Back in the 1860s, he was called upon to investigate an epidemic of typhus in Silesia, which is now part of Poland. And he argued that it was pointless to treat one after another individual patient. If you were to stop the epidemic, it would be necessary to tackle its underlying determinants. And he called for radical action to improve the lot of the victims of the typhus epidemic. What did he mean? Well, he was a pathologist, so you might expect him to be focusing on the louse. But no, he meant full and unlimited democracy and education, freedom and prosperity. He attacked the powerful vested interest that kept so many people in abject poverty, reserving his strongest criticism for the church, which was the spiritual guardian of the social order. He famously described Bismarck's anti-clerical laws as, quote, a great struggle in the interest of humanity. But surely this went far beyond the brief of a pathologist. Not at all. He summed it up succinctly. Medicine is a social science, and politics is nothing but medicine on a grand scale. But it's not only his politics that attracts me. It was his ability to convey a clear message, a simple message clearly. When he spoke out against Bismarck's excessive spending on the army, the Iron Chancellor challenged him to a duel. As the recipient of the duel, he had the right to select the weapons. He viewed guns and swords as uncivilized, and instead chose 2 sausages, one of which was infected with trichinella larvae. Bismarck withdrew. It's become a cliche to say that the world is changing. And of course, I could spend the rest of this talk describing how it is changing. The climate is changing, even if not everyone realizes it. And we still have some way to go to convince some of the more eccentric visitors from my country to you, and some of the politicians from your West Island. I see that you had Lord Monckton recently in New Zealand, who has rather unusual views on climate change. Not just the climate that's changing, the population of the world is changing, increasing and becoming much more mobile. Or at least some people are becoming more mobile. It's relatively easy for someone like me to get into New Zealand, but just like my own country or your Western neighbour, not everyone is welcomed everywhere. And the distribution of resources is also changing. Sorry, I should have said a little bit of a reflection on the migration issues in New Zealand, I beg your pardon. And the distribution of resources is changing. The economist Thomas Piketty has shown us so graphically earlier this year, with virtually all economic gains now going not to the top 10% or even the top 1%, but to the top 0.1%. So if we in public health are going to adapt to this changing world, Virchow's call to engage in politics shouldn't be controversial, I would suggest. After all, we in the public health community have long ago signed up, and we were just talking before during the lunch break, to the concept of health in all policies. Yet are we really willing to follow through on the implications and make it a reality? Some of our colleagues in medicine epidemiology question this. Ken Rothman, a very famous epidemiologist, has insisted that epidemiologists are not social engineers. He was responding to criticism by your own New Zealanders, Ruth Benita and Robert Beaglehole, who had argued that, and quote, unfortunately for many epidemiologists, the study of social factors is considered too political. It's necessary for epidemiology to affirm its connection with policy and to reject scientific isolation. Now, clearly, I'm on the side of Rudolf Virchow and of Robert and Ruth. But I can't just assert this view. I can't just say it again and again and hope that people will believe it. I need to justify it. because people will say, what right have I as a public health professional to challenge my government, or indeed anyone else's government? After all, those governments have, for the most part, a democratic mandate to act on our behalf. I don't. Nobody has elected me. There are, however, a few problems with this argument. And the first is that just when we need them most because of all these changes that are taking place, our democratic institutions are not working anything like as well as they might. Who do our political leaders really represent? Over 2,000 years ago, Plato recognised this problem. He wasn't a fan of democracy. He placed it fourth among the 5 forms of government in order of desirability, below oligarchy, but at least it was above tyranny. He invoked an image from beekeeping to depict what he saw as the democratic society, as one dominated by a class of pleasure-seeking individuals detached from reality. He described them as idlers or drones. The leaders who emerged from this class lacked any ability to govern in the best interests of the people, but were instead guided by their own interest and popularity. These leaders were the ones who did all the talking, while the rest settled near the speaker's platform and simply buzzed. Maybe Plato's concerns have some contemporary resonance. His idler class, possibly, include those whose life rotates around daytime television and celebrity magazines. The leaders are still those who can talk, regardless of whether they have any ability to exercise judgment or to manage the complex functions of government. The dominance of celebrity is apparent in the former actors Ronald Reagan and Arnold Schwarzenegger, both former governors of California, with one going on to become the US president, or the former professional wrestler, the governor of Minnesota, Jesse Ventura. They're the telegenic face of a political class that is seen as remote from the public, sharing few of its concerns or life experience. The British Parliament, for example, is now dominated by individuals who have progressed through internships and posts as researchers for other politicians, often taking advantage of family connections before being elected in their early 20s. In fact, we have a challenge in the UK at the minute, because when we were looking for a new Solicitor General recently, it was found that this was in the past a Member of Parliament who was a Queen's Counsel, a senior lawyer. And now there are 8 in the whole of Parliament, 6 on the Conservative bench, most of whom are nearing retirement age, and 1 each in the Labour and the Liberal Democrats. We're simply running out of people with experience. And so for these people, whether their life experiences are shaped by the fantasy world of entertainment or the constrained world of political elites, few have any experience of the real world. Plato correctly identified the source of the problem: ourselves. We, the public, faced with the daily struggle of getting through life or getting through operating lists, as we were discussing earlier today, are content to leave the business of government to others, no matter how bad a job they make of it. And Plato was not alone. Jean-Jacques Rousseau took a similar view. He believed that a true democracy required a level of engagement from citizens that would be all-consuming and thus impossible in practice. And of course he was right. All around us we see disengagement from the political process, particularly among younger people and those with the fewest financial and educational resources, the groups who are most affected by the political elite. Turnout in elections in industrialised countries fell substantially over the 20th century, declining to below 50% for the first time ever in the 1996 US presidential election, although not as low as the 20% that we now see in local government elections in the UK. 2 years ago, the British government, in a particularly ill-thought-out initiative, introduced elections for newly created posts of police commissioner, and in the Q&A, don't ask me what they do, I haven't a clue. And the public responded with overwhelming apathy, with voter turnout of just over 10%. And in fact, in the latest by-election held last week for a police commissioner, it was actually below 11%, it was 10-point-something%. And some polling stations for the police commissioners, not a single vote was cast. Now, fortunately, the situation here is very much better, but the trend is still worrying, the trend is still downward. And I think the problem we face in many of our so-called democratic states is that a substantial share of the electorate, perhaps not here, but certainly in many other countries, has voluntarily disenfranchised itself. But that's not the only problem with our political systems. We also face what John Stuart Mill described as the tyranny of the majority, whereby the majority in a society imposes its norms on an often defenceless minority. Our research, and research by Alberto Alesina at Harvard, has shown that governments of countries that are most fragmented on ethnic, religious and linguistic grounds invest less in what we call public goods, those things like healthcare that benefit everyone. We also found in Europe that those countries were less likely to adopt healthy public policies. This is intuitive. After all, why spend money on something that will benefit those with whom you have nothing in common? So if our leaders are out of touch with our needs, our desires, our expectations, and if they're ignoring at best and trampling upon at worst the needs of the most vulnerable in our societies, who are they representing apart from themselves, of course? I should have said that's the slide showing the relationship with social and racial fractionalisation. As the Canadian author Naomi Klein has catalogued in great detail, in many countries we're experiencing the corporate capture of government. One of the greatest changes that we've seen over the past 4 or 5 decades is the massive consolidation of manufacturing and sales in mega corporations, many far larger than individual countries. Of course, much of this is invisible to the public as these large corporations hide behind the spectrum of brand names. And it's interesting when you look at all the names that you might think are individual companies, just how consolidated they really are. Coca-Cola, PepsiCo, Kellogg's, Mars, and so on, absorbing really pretty well everything that you're likely to buy in the shops. We all know that Nestle make Nescafe, but did you know that they also own Perrier, San Pellegrino and Kit Kat, for example? PepsiCo emphasise their healthy ownership of Quaker Oats and Tropicano juice, but they say much less about their links to Pizza Hut and KFC. And other corporations, of course, have portfolios spanning food, domestic products, alcohol and much else. Amazon is now the retailer to the world. But you're probably asking, what on earth has this to do with democracy? Well, I would suggest that what we often fail to see how when power is so concentrated in a few hands, those with the power can set the rules. Democratic governments are effectively powerless in the face of all of this. Finally, I think the public are waking up to this. And some politicians, they're waking up to this changing reality. And this is one of the biggest changes that we have seen in society in the last few decades. Where have all the small shops gone? Where have all the small manufacturers gone? For years, governments have competed to attract these corporations to their countries, dazzled by the prospect of inward investment and employment. We all knew that there was a price to pay, and it usually involved lowering taxes and paying for the infrastructure for people to move into, paying for the factories for them to occupy. But what we didn't realise was that these people were running rings around our tax systems by creating complex transfer pricing arrangements where profits were banked in a low tax jurisdiction. Almost nothing came back to our countries to pay for health and education. Some of the largest corporations managed to find ways to avoid paying taxes anywhere in the world. And I think this is a question to be looked at when you look at who is doing all the reconstruction around here, for example, and particularly whether or not the work is actually benefiting people from Christchurch as opposed to other people being brought in on minimum wages from elsewhere. So these favourable arrangements for the large corporations meant that the remaining small and medium enterprises who sourced the goods and services locally and who did pay taxes faced an impossible task. Who in their right mind in this world would open a small independent bookshop today? But that was only the start. And to understand what happened next, we need to reflect briefly on the changing geopolitical landscape. Many of the large service providers like Halliburton have enjoyed a fantastic decade. They thrived on disasters. The wars in Iraq and Afghanistan created one opportunity after another. They could promise the earth knowing that they never had to deliver it. After all, who was going to go out and check whether the schools that they were paid to build in Helmand province in Afghanistan even existed? Profit margins, we discovered in work that, wearing another hat, we found profit margins of 800% were not uncommon. But all good things must come to an end. We, the public, have tired of foreign adventures. We're even in the face of genocide, clear genocide. At the minute, we're reluctant to intervene in Syria and Iraq. If you recall, this was not the case in the past. We were willing to invade Iraq in search of entirely imaginary chemical weapons. But we're not prepared to act against Syria. So if we're not going to have profitable foreign wars, these corporations need something else, and that something else is health and education. The education bit is very straightforward. You just need to get a group of children and sit them in a class, ideally in a very large class, taught by cheap, unqualified teachers. And that's what we're doing in the UK. As Naomi Klein has shown once again, the big corporations took advantage of any disaster they could find. After Hurricane Katrina, they moved rapidly into New Orleans to finish the job of sweeping away the public education system and replacing it with for-profit charter schools. You've seen some of this, of course, at first hand as you struggled to clear up with after the earthquake. You were generously offered a new hospital, I understand, funded through a public-private partnership. I don't know if you know how much you know about the unfolding disasters that we have in the United Kingdom associated with this model, but I would put it to you that you were extremely wise to reject this white elephant. But the problem with health is rather more difficult. The problem has been set out, and I've mentioned this in some of the other talks already this week, very clearly in a book by the Scottish GP Margaret McCartney. Healthcare involves a huge amount of unpredictability. You never know what is wrong with someone until you've investigated them. You think you've got you think that they have a cheap, simple condition, and then you perhaps find widespread cancer, plus a few previously undiagnosed chronic diseases. And as we're constantly being told, markets hate uncertainty. So faced with this uncertainty, there are a number of possible solutions. You can reject the market and go for an integrated model of care, based on long-term relationships which reduce transaction costs, provide seamless interfaces, and remove incentives for gaming and opportunities. You might recognise this. Or alternatively, you can point out that governments have less and less money to pay for a changing situation in which there's an ageing population with an increasing burden of chronic diseases. You know this because the reason that governments no longer have any money is because all the corporations are no longer paying taxes. And of course, if you are promoting this more market-orientated view, you seek to convince the government that the welfare state and the healthcare system is unaffordable. The governments, faced with these overwhelming arguments, with a barrage of reports from think tanks whose funding is extremely obscure, give up, believing that whatever they do, they'll never be able to meet all these needs. But if you're in healthcare, and if you're providing healthcare for profit, you do need to make money. And you can only do that where the return on investment is much more certain. So the answer is simple. Offer treatment to people who are perfectly well. That's the business model. Now, of course, you need to convince them, first of all, that they aren't perfectly well. But it's really quite easy, as you all know. You just need to offer them enough screening tests, telling them how they might suffer through ignorance if they haven't already decoded their own genome. Eventually, if you look hard enough, you will always find something to treat. And remarkably, they will feel better now the anxiety that you created has been alleviated. The art of the homeopathist throughout time. The point I'm making is that it's not our elected governments that are setting the rules of the game. It's now the large corporations. And it's not just in relation to healthcare. It now affects every aspect of our daily lives. These corporations ensure that they're never constrained by the law. Regulation is to be avoided at all costs. Instead, there must be voluntary agreements. Yet, as Mike Dobb from Perth in Western Australia has noted, manufacturers know better than anyone else that tobacco control legislation is designed to succeed, but voluntary agreements are designed to fail. Voluntary agreements do fail, and in that they succeed brilliantly. So if these large corporations have to accept regulation, they limit it as far as possible, arguing that what is being asked for is technically impossible or unaffordable. The food industry argued that reducing salt and trans fats from all its products was impossible, even when it was already doing it in those places that had introduced legislation. So they would do it in Denmark, but they would say it was impossible to do it in Brazil. The tobacco industry argued that smoking bans would put people in the hospitality industry out of work, even though the only studies that could show this were those that it had funded itself. But they often don't argue against regulation themselves. They pay others to do it for them. And if they can't get true grassroots organisations, they just create them, what we call the so-called AstroTurf organisations. And they work assiduously to muddy the waters, creating just enough doubt to block actions. We've described the range of tactics that they use as denialism, drawing on the methods that have been used by revisionist historians about who challenged the accepted account of the Holocaust. And they include cherry-picking the evidence and moving the goalposts by setting impossible standards of proof, paying false experts, promoting logical fallacies. The studies that they fund often reach systematically different conclusions from independent research, or they suppress unfavourable findings. Studies on second-hand smoke undertaken by the cigarette industry were 88 times more likely than independent studies to report it as harmless. For many years, the tobacco industry argued erroneously that better ventilation was the solution to second-hand smoke, anything to avoid banning smoking in public places. And unlike us in the public health community, their arguments get a hearing at the highest levels. The food industry spent $1.4 billion on lobbying the European Union against traffic light labelling on food. But sometimes, despite all of these efforts, regulations are introduced. But if you are a profit-seeking corporation, this is no reason to give up. It just creates a new challenge. How do you capture the regulator? And this can be done by holding out the prospect of lucrative earnings in retirement for those regulators who are sympathetic to the corporation's point of view. Or it can be done by helping the hard-pressed regulator to develop the rules. Tobacco industry lobbyists successfully influenced the adoption of impact assessment procedure by the European Union that emphasised the economic impacts but paid scant attention to the health impacts so benefiting their products. In a paper we published about 2 weeks ago, we showed using a textual analysis of the wording of the legislation as it progressed through the process that it became more and more friendly, empirically we showed, to the tobacco industry as it went through. But it's even better if you can capture the policy as it's being made. Revolving doors between parliamentarians and corporations help. And governments are often willing to accept free advice, such as how to privatise a particular essential service. Indeed, they're especially keen to get free advice after they've slashed jobs in the civil service, leaving no one with any idea how to formulate a policy. Well, after listening to what I've been saying, I'd like to think that that you're rather angry. That's really, you should be, I think, after listening to this. Angry that our democratic systems that our predecessors fought for are now broken. Angry that those who claim to represent us are acting on behalf of powerful vested interests. And as I haven't really said anything new, I'd like to think that the public would be angry too, but the sad fact is that they're not. We see all around us what J.K. Galbraith described as a culture of contentment. We all think that nothing can be done. And anyway, we're all sort of okay. Does it matter? Fair enough. Our incomes in real terms have hardly improved in 2 decades, but at least we aren't starving. Of course, we've only retained our living standards in many industrialised countries by getting into debt with mortgages around our necks, in many countries with student loans, student debts from which you can't escape. Now that the politicians in my country and the US have exempted student loans from bankruptcy proceedings. And here I would point out that there is another way. Some time ago, earlier this year, Germany abolished all university fees and showed that it can be done. But elsewhere, in essence, I think we've been turned into a middle-class version of indentured labourers, terrified of going on strike unless we lose our homes. And in many ways, we've also become more selfish. We're much more likely than in the past, we're much less likely than in the past to support social solidarity. And in my country, support for the welfare state is at an all-time low among what are described as Thatcher's children. Well, it would be reasonable to be quite depressed after listening to all of this. Given the forces ranged against those of us who want to make a better place, maybe we should simply give up. But that's the last thing that we should do. Whatever the challenges we face now, they're nothing compared to the challenges that were faced by Rudolf Virchow. As health professionals, I believe that we can make a difference. But if we're to do so, we have to change the way that we do things. As Karl Marx said, the philosophers have simply described the world. Our task is to change it. But what does that mean for those of us who are health professionals in practice? First of all, I think we need curiosity. We need to be asking continually why, and we must never be satisfied with the answer because I say so or because I'm an expert. Let me just illustrate this with our work on the financial crisis. I'll be talking about it in Auckland tomorrow. When the financial system was collapsing around our ears in 2008, the overwhelming consensus in the media and from the commentariat and from the politicians was in favour of austerity. Whenever your income falls, you cut expenditure. And governments did see their incomes fall. As tax revenues collapsed, we were especially badly affected in the UK because we were so dependent on the financial sector. Well, we as health researchers, we could have simply accepted this consensus. We said, that's what everybody is thinking. All these eminent economists and politicians must be right. And how could we as simple health professionals know any better than them? But when we looked a bit closer, we saw that there were some problems. First, not all the economists agreed. There were a few, such as Danny Blanchflower and Paul Krugman, Joe Stiglitz, who took a very different view. They pointed out that while austerity may make sense if you're talking about a household economy, it doesn't make sense if you're talking about a country. One person's reduced spending is another person's reduced income. And in this way, impoverishment spreads. They recalled that this is, or at least was, well known. Keynes in the 1930s showed the importance of governments putting money into the economy. He only half-jokingly suggested that the government should bury jam jars containing pound notes so that others would engage the unemployed to dig them up. And then came the clincher, at least for those of us in the UK. Our government ministers argued that austerity was necessary because of our massive debt. And yet when we looked at the data, we saw that they were being what a former British cabinet secretary, when he was in Australia, said he was being economical with the truth, our cabinet secretary. Our level of public debt was actually very low. Now, I was in Melbourne, I was in Australia at the end of April when Joe Hockey was passing his first budget, and he was saying that Australia had a debt crisis with a debt to GDP ratio of 14%, which is barely detectable on that scale. So even at the onset of the financial crisis, even though it had gone up a bit, our level of public debt was relatively low, and it was far lower than it had been in the post-war period, when an earlier government was able to invest in creating the welfare state and the National Health Service. Now, of course, almost everyone, except for a few remaining ideologues like our Chancellor of the Exchequer and Olli Rehn, the EU Finance Commissioner, accept that austerity was a massive mistake. Even the International Monetary Fund has confessed the error of its ways. I should say that given what has subsequently turned out, it gives me very little pleasure to note that I and colleagues pointed this out at the time, arguing that austerity would not work in a paper that was published at the onset of the financial crisis. It was interesting when we submitted to this paper to the BMJ, our views attracted ridicule, and I still have the reviewers' comments when they rejected our paper. But our unwillingness as health professionals to accept what was then the accepted wisdom encouraged us to challenge what was being done in our name. And as we've subsequently done in rather a large number of papers in the Lancet and elsewhere, we've been able to serve witness to the devastating consequences of austerity in health. But even then, of course, we weren't right about everything, because we did accept some things at face value, and we made one big mistake, and that was to accept at face value the work of two eminent Harvard economists. And they had done work which really underpinned the argument for austerity. They argued that when the debt to GDP ratio exceeds 90%, economic growth will reduce. It didn't really matter so much in the UK because it was still below that level. But it was one that was very much used to justify austerity. If debt goes up, growth will go down. But what we didn't realise, because we were not very trusting, but we were too trusting then, was that in fact their conclusions were based on a simple error in a spreadsheet when they failed to drag a selection far enough down the column. So even there we should have been more curious. The point is, always check the data, especially where the papers are coming from economists. But there are many others who've shown why it's important to be curious. And I'd once again like to single out those medical pioneers in general practice and hospitals in Canterbury, in Christchurch, who have questioned whether the established ways of doing things were the best and whether there were alternative ways of easing the patient's journey between hospital and community care. You too also challenged the accepted wisdom, and for that I think you need to be congratulated. But we need more than curiosity. We also need to be willing to take the initiative. Public health, medicine needs many more social entrepreneurs, people who will spot an opportunity and go for it. We need people who are prepared to take risks. But we also then need to be willing to accept failure. We still adhere to a culture where the message is often that it's better to do nothing than to accept failing. This is a challenge, I think, for those of us who are in senior positions, because it's up to us to make sure that our junior colleagues know that if they do something wrong, it's us that take the blame and we don't transfer the blame to them. Because if we do that, nobody will innovate. We need to make connections. Over the past half-century, epidemiology has achieved an enormous amount in identifying individual risk factors, but we also need to be able to look upstream to identify the causes of the causes, and downstream to understand the biological mechanisms to go right across the spectrum. In our work in Russia, we have sought to understand the catastrophically low life expectancy. We began with the usual examination of the data, breaking down deaths by age, sex and cause, and we used the standard technique of a case control study, albeit a rather unusual one because our cases were dead, but that's another story. We followed it up with a more conventional study when we turned our controls into a cohort, and we showed that the main driver of premature mortality was alcohol. Although more specifically, it was the consumption not of vodka, but of aftershaves, in Russian eau de cologne, and technical spirits containing up to 95% ethanol, as well as what the Russians call zapoi, which is essentially a binge lasting for several days. And we showed in a paper in The Lancet, that then in our other one in PLOS One, that these together accounted for almost half the deaths of men of working age, but that was only the beginning. Because if we were going to understand what was going on, we had to look upstream and downstream. We need to look upstream to understand why Russians drink in the way that they do. And that took us along the path of trying to understand how people respond to profound social and economic change, and especially why some people are more resilient and some people are more effective than others. Now, the work that we did led us directly into the work on the financial crisis, because that was another major economic and social change that took place. But we needed to go beyond that. We needed to look downstream to ask why so many heavy drinkers die suddenly with clean coronary arteries, because within our work we were also doing autopsy studies. And that's given us new insights into the nature of cardiovascular disease in other heavy drinking populations that are more difficult to study. And our most recent research has shown that the heaviest drinkers are what we might consider good lipid profiles, but also have high levels of brain natriuretic peptide, indicating myocardial strain. We showed this was not a uniquely Russian phenomenon, because in this paper we also looked at a cohort from Belfast, in my own home city of Belfast. So I think this is just a reminder in a changing world that we need to look right across the spectrum. We also need to be able to convey the big picture. And it's not at all easy to do with the tools at our disposal, especially when we constrain ourselves with the narrow frameworks for assessing cause and effect, such as Koch's postulates or Bradford Hill's criteria of causality. These frameworks clearly have a very important role, but only in certain circumstances. To take another example from our own work, we know that levels of tuberculosis vary widely in different parts of Africa. But why? There are many reasons, but one is the extent of mining. So we've been able to show, using modelling data and using other epidemiological data, to show how mines act as amplifiers for these diseases, in the same way that we showed that prisons in Eastern Europe did exactly the same. We can never do a randomised controlled trial to show this, but with some imaginative use of data supported by mathematical models, we can provide strong evidence of a link. And again, we see examples for those of you, we can see how you bring this all together in the way that you looked beyond the immediacy of getting a new hospital and the public-private partnership to look at the big picture and to look at the long-term consequences. Well, the fifth point, I think, is to know what we're up against. And this is where I come back to my earlier comments about transnational corporations. We all know that the tobacco industry has spent years undermining the efforts to tackle one of the leading causes of premature death. But we also need to look at the role of the large corporations in other areas such as the food industry and, sadly, increasingly the pharmaceutical industry. So I would argue that more than ever before, health professionals need to read The Economist, the Financial Times and the Wall Street Journal. Sixth, I think we need to engage with key decision makers at all levels. And the ASMS, I've been very impressed at the way that you do this, and certainly with the work of Ian and Lloyd and many of the other colleagues here, Kushna, really very impressed just in the few days that I've been in New Zealand. But if we're to do so, for many of us, I would suggest that we need a great deal more self-confidence. Too often colleagues say that they cannot comment on something because they don't know anything about it. But you can turn on the radio or television any day and hear eminent politicians and social commentators who are perfectly happy to speak about issues that they clearly know nothing about. Where they differ from us is that they have the self-confidence or perhaps the arrogance to go on national radio or television to express their ignorance. But yet, given a few hours and a fast internet connection, most students could do a much better job of understanding the topics that they're discussing. Now, of course, we need to be careful that we don't stand up and talk nonsense, but at the same time, we must realise that many of the self-appointed experts have only the most superficial understanding of complex issues, and we should not be reluctant to challenge them when their stupidity acts against the interests of health. And of course, we do need to engage. And yesterday, as some of you know, I spent all yesterday afternoon in the Treasury discussing the economics of health. Some of you heard the talk I gave the day before, and we developed that in a little bit more and went into some of the more technical details. But we need to be in there. We need to be talking to the Treasury. We need to be talking to other bits of government. We also need to exploit new ways to communicate, and again we were talking about that in the ASMS meeting the other day. Social media offers a powerful tool to spread messages that are ignored by the mainstream media, which is increasingly dependent on advertising by those vested interests that are undermining health. And these days I certainly find that I learn an enormous amount from Twitter, whether being pointed to a paper that I might have missed or a blog offering a new insight on a contemporary issue. And Twitter does get to the places that other media don't. Some of us fought a long, although ultimately unsuccessful, campaign to stop the current British government's reforms that will essentially destroy the NHS. And as we noted in the BMJ, Twitter played a hugely important role in exchanging information and organising ourselves. And across the Tasman Sea, Simon Chapman has achieved the ultimate accolade of having a parody Twitter account created using his name, a sure sign that he is seen as a threat to the peddlers of lies and distortions. We must ensure that our approach to health is firmly grounded in human rights. The Public Health Association of Australia, for example, has spoken out strongly against the treatment of migrants by the Howard government, using practices that have sadly been continued by governments of both major parties there. But there's real cause for concern in Europe. It's too easy to be complacent, to think that we've learnt the lessons of the 1930s and such things could never happen again. But there's a real danger that the terrifying absence of political leadership we see in Europe today could too easily create the conditions that in the past led to the rise of totalitarianism. And you might look at these armbands, and that's Jobbik in Hungary, and think, isn't this rather reminiscent? It may not have quite the exact same shape as the swastika, but it's not too far off it. The warning signs are already there, with dark forces in many European countries using populist messages to exploit fear and anxiety about minorities. I would argue that a democratic society based on social justice and human rights is a core requirement for any healthy society. Now, I'm well aware that this isn't easy. Some of you will have read or seen Ibsen's play, An Enemy of the People. The local doctor, Thomas Stockman, discovers that the water supply to a Norwegian spa town is contaminated and people are becoming ill. But if he speaks out, he risks ruining the local economy. He summed up his predicament as saying, "The strongest man is he who stands alone." He was on his own, but we're not. We've already achieved a great deal, and look at our successes as health professionals against tobacco. But there's much more that we can do, and unlike Dr. Stockman, we're not alone. It would be great if we could depend on our political leaders to act on our behalf and to act in the interests of the people that they're supposed to represent. But I unfortunately feel, and you have your own recent account, as you know, in Nikki Hagen's book, that it doesn't always happen. And in these circumstances, we need to act. And I would just finally leave you with some words to point out about what we can do. It's never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Thanks very much.